Hi everybody, I am here to give the introduction to clinical pathology DMLTS. So let's begin. I am going to explain in this video is the terminology in pathology and introduction to pathology and branches of pathology. So let's begin. So basic information. Now you can see here pathology is the study of disease process within the aim of understanding their nature and causes. And this is achieved by observing blood, urine, feces and diseased tissue obtained from the living patient or at autopsy by the use of X-rays and many other techniques. The great human pathologist Rudolf Virchow is the father of pathology. Here, the clinical pathology is thus the application of knowledge gained to the treatment of patients. So, the study of pathology is divided into two parts. One is the general pathology, another one is the systemic pathology. General pathology, it deals with the general principles of diseases. And systemic pathology, it is the study of disease related to the specific organs of the body system. This is about the basic information. So now in next slide, terminology in pathology. So health it is the state of complete physical and mental and social well-being. Disease, states of discomfort to the body is disease. And patient, a person affected by a disease is you can call them as a patient. Pathology, pathos means disease, logos means study. Pathology is a scientific study of diseases. Symptoms are those which are narrated by patients and his relatives. Signs are those which are observed by clinicians or physicians. This is about the science. And ethology. Ethology means it is the causal factor responsible for the formation of diseases. It is about ethology. And even pathogenesis. Pathogenesis means the mechanism by which the disease is produced. And fate, it is the outcome of disease. Outcome of disease is called as a fate. And morphology is the structural features of the diseases. And clinical significance, the functional features of the disease is called as a clinical significance. Syndrome, a syndrome is an aggregate of signs and symptoms or combination of lesions without the disease cannot be recognized or diagnosed. For example, hypertension. So primary disease is the disease without evident cause. For example, primary hypertension is defined as abnormally high BP without apparent cause. This is about the primary disease. Now, what about the secondary disease? Secondary disease means which represent a complication of some underlying lesions. For example, secondary hypertension defined as abnormally high BP as consequence of some other lesions. This is about the terminology in pathology. So, introduction to pathology. What is pathology? So, let's see. Pathology may be defined as the scientific study of the molecular or cellular or tissue or organ system in response to injurious agents of adverse influences. And the purpose of study of pathology is to diagnose and treat and prevent the disease from the knowledge gained through the cause and pathogenesis and effect. This is about the pathology. Pathology deals with the disease process involving ethology, pathogenesis and clinical effects of disease in animals and tries to explain what went wrong. It is linking the basic knowledge gained in anatomy, histology, physiology and biochemistry and clinical subject in making diagnosis of disease and helps in treatment to prevention and control of disease. It is about the introduction to pathology. So, branches of pathology. What are the branches of pathology? You can see here anatomical pathology, histopathology, cytopathology, chemical pathology. These are the branches of pathology. Still many are there. Now let's start with anatomical pathology. What is anatomical pathology? It deals with the tissue diagnosis of disease usually from biopsy materials taken from a patient in the operating theatre or on a ward or from an autopsy means post-mortem. This is anatomical pathology. What is histopathology? pathology. Histology means tissue. It is the study of microscopic changes or abnormalities in tissue that are caused as a result of disease. What is cytopathology? Cyto means cells. It is the diagnostic technique that examines cells from various body sites to determine the cause or the nature of the diseases. So chemical pathology or biochemistry, you can call this as also biochemistry. So it deals with the entire spectrum of illness, often involving detecting changes in a wide range of substances in blood and body fluids. For example, electrolytes, enzymes and proteins that change in many diseases. Yes. So in addition, it involves detecting and measuring tumor or cancer markers, hormones, vitamins, poisonous and both therapeutic and electric drugs. For example, test cholesterol and triglycerides to diagnose risk factors for heart diseases. This is about the chemical pathology. Now, in next branch is clinical pathology. Clinical pathology is the branch of pathology dealing with the study of disease and disease processes by means of chemical. So microscopic and serological examinations. Sample test includes complete urine analysis, stool and other body fluids analysis. So what is the forensic pathology? Forensic pathology means it is the subspecialty of pathology that focuses on medical legal investigations of sudden or unexpected death. So a forensic pathologist is primarily involved in identifying the cause of death and reconstructing the circumstances by which the death occurred. This is performed in meticulous, painstaking manner. Forensic pathologists are occasionally required to visit crime scenes or accidents or to testify in court. So genetics means it includes three main branches. One is the cytogenetics, molecular genetics, biochemical genetics. What is the cytogenetics? Microscopic analysis of chromosomal abnormalities is called as a cytogenetics. In molecular genetics, uses DNA technology to analyze mutations in gene. Biochemical genetics are specialized biochemical testing to identify specific markers. It involves tests on chromosomes, DNA and specific biochemical markers from body fluids, cells in body fluids and tissues to diagnose genetic diseases. For example, test is cystic fibrosis, gene test, Down syndrome, chromosomal test and maple syrup urine disease and biochemical genetic test. This is about the genetics. Now hematology, immunology, microbiology, general pathology and nutritional pathology. In this slide we can start. Hematology it deals with the many aspects of disease which affects the blood, such as the anemia and leukemia and lymphoma and clotting or bleeding disorders. It also encompasses the subspecialty of transfusion medicine, so which includes blood typing and compatibility testing and management and supply of large range of blood products. For example, iron clotting test to check warfarin doses is correct. Immunology, immune function test can determine whether an individual is allergic and if so, what to do. Many disease results from the immune system. Defense systems in improperly targeting normal organ system resulting in autoimmune disease. For example, cellular lupus. Microbiology. What is microbiology? It deals with the disease caused by infectious agents such as bacteria, viruses, fungi and parasites through tests on blood, body fluids and tissue samples, example urine and sample to detect urinary tract and infections. So this is about the microbiology. In general pathology, what is general pathology? What are those? So general pathology, it covers all areas of pathology at less specialized levels. So for example, test pathology laboratories have general pathologists and managing tests from more than one discipline or including chemical and anatomical pathology. So hematology and microbiology. This is about the general pathology. What is nutritional pathology? It is the study of disease processes resulting from deficiency or excess of essential blood foods. For example, scurvy caused by vitamin C and deficiency. So in this slide you can see about the talk about the toxicopathology and oncopathology, molecular pathology, and genital inherited disease and oral and maxillofacial pathology. So let's begin. Toxicopathology, it means the study of disease caused by the toxic substances. Toxin may be chemical or biological or physical agent. For example, test includes testing of blood for presence of alcohol, presence of drug in athletes. Oncopathology, onco-tumor branches of science which deals with the study of unusual developing and multiplying portion of the body that are termed to be tumors markers test. Basically, it is the branch of a science dealing with cancer. Oncopathology means cancer branch of science dealing with the cancer. Oncopathology deals with the cancers. So molecular pathology, this branch of a pathology studies and diagnoses the molecular that make up the organs and tissue of the body. It includes the study of disease and chromosomal abnormalities at the molecular level to aid in diagnosis and therapeutic intervention of disease processes. There are the three areas of testing that includes genetics, hematopathology, and infectious diseases. Genetically inherited diseases can be prevented by early diagnosis using molecular level. So now in oral and maxillofacial pathology. What is the oral and maxillopathology? Pathology. It is considered as one of the 9 specialists of dental medicine. Oral pathology studies disease that affected oral cavity and its surrounding structures. So this is about the oral and maxillofacial pathology. So this is about the DMLTS of clinical pathology. Thank you.